Good evening and welcome to another episode of In the Studio. This show is a 30-minute interview show produced by Davis Media Access. That is your community media center, and we are here tonight with the help of their expert staff and several community volunteers. This show is being broadcast over cable, and we also have other episodes as well as this one that are available on our website, and that is dctv.davismedia.org. I am Diane Crumley, a volunteer for the organization, and I'm happy to be the host tonight for our topic of alternative veterinary medicine. And our guests tonight are from Davis's Center for Integrative Animal Medicine, and they are Dr. Madeline Yamate and her practice manager, Jill Quan. And we also have Holly the Wonder Dog here as well. Ladies, I'd like to welcome you and thank you very much for coming to In the Studio this evening. I think that I know that you both have very long and experienced bios that I read about on your website, and I know that Dr. Yamate, you come from first a biology background. Then you have an MBA. Then you went to our wonderful School of Veterinary Medicine here at Davis.
Yes.
And then continued with extensive training in, let's say, what we're calling it, traditional Chinese veterinary medicine.
Also, veterinary spinal manipulation, which is the equivalent of, animal chiropractic.
Okay, well, I mean, I salute you, first of all, for all of that training. And Jill, I read that you are a long-term volunteer and dog trainer for it's Canine
Companions for Independence. Yeah, I'm raising my 12th puppy for them, and they provide service dogs for people with disabilities.
And is that a national organization, but we have a local chapter of that?
It is, yeah. It's a national nonprofit. The dogs are provided at no cost to the recipients, and in this area we have a chapter and about 70 active puppy raisers. And also what we call breeder caretakers, which are the people that have the sires and dams and produce the litters for us. So the dogs are bred specifically to be service dogs.
Excellent. Well, I know I have seen various puppies in training as I'm walking around Davis oftentimes.
Yep. We have lots of puppy raisers in Davis.
Excellent. Well, first of all, Dr. Yamate, if you would just tell us a little bit about this whole term integrative medicine and how that basically complements both, Chinese traditional techniques and then what folks usually associate with Western veterinary medicine.
So our more common and well-known modality of medicine, veterinary medicine, is going to be Western. Sometimes we also call it allopathic medicine, but there are also many other modalities that we utilize in the medical, human, and animal world, and those are typically called alternative medical modalities. So the old term was complementary and alternative medicine, or complementary and alternative veterinary medicine, so we'd call it CAM or CAVM. And then things started to change because people got confused with the whole CAVM type thing. And I think at times it was thought that maybe people had a negative view about alternative medicine, because alternative sounds like not such a good idea, right?
Right.
So the terminology of integrative medicine came about, and integrative is where we're using our standard Western medicine in conjunction with these alternative modalities. So that's one of our newer terms. Progressively, we've also called it functional medicine. So it's kind of a whole issue of semantics, but the fundamental thing to understand is that in using other modalities besides our Western medicine is going to be either complementary or integrative. Some people also use the terminology holistic medicine. And holistic is more about looking at the animal as a whole, not as parts. So even though, yes, we're made up of a heart, liver, kidney, bladder, other organs, we put the whole animal together. So, for example, in Chinese medicine, since it was a system of medicine that was developed over 3,000 years ago, they didn't have our cool tools like stethoscopes and, blood analyzers.
Yes.
And so what they would do is they would, observe, smell, listen, taste, and they would create a landscape of symptoms and come up with what they would call their own diagnosis. And it would be about balance, okay? So here I would say, for example, let's say that Holly had a weakness in her hind end, okay? We would just, in Western medicine, it's weak hind end, is it hips, is it actually the full leg?
And they would x-ray?
Correct.
Yeah, okay.
That would be our ideal, would be to do x-rays. In the Chinese realm, we say that the kidney, and it's not the Western kidney, it's the Chinese medicine kidney, is responsible for the hind end. It's also responsible for bones and joints, but it also has specific, kidney functions as well. So it is more than just our Western biomedical kidney. So in Chinese medicine, if Holly, say for example, had a hind end weakness, we would say one of her diagnoses may very well be a kidney qi deficiency, meaning that she can't maintain that hind end, fully upright and straight. So she's weak in that hind end. So they developed their own system of diagnostics and also basically nomenclature. So I always tell people it's kind of like that game Battleship. It's like B12, E33. So it's just a nomenclature that we may use in terms of how we may diagnose a patient. Okay?
Well, I think one thing that, since we have Holly here, I know that I have spoken to people, and because I have actually had positive experience with acupuncture for myself to help with migraines, with chronic migraines, and then I have had several geriatric pets, and while I was living in New Mexico, there I experienced acupuncture for my 18-year-old cat who had terminal cancer, and he was in pain, and so and I was amazed and so happy with how well he responded to this treatment. But I think there are so many people who are afraid of needles, and they think, when they think acupuncture and when they think Chinese medicine, I think that's the first thing that comes to mind. So maybe you could tell us a little bit about, like, for example, how incredibly small these are, and then I don't know if you're ready to demonstrate or to talk about what a sort of maybe typical procedure might be if you deemed that your patient was needing acupuncture.
Okay, so typically, since we practice primarily traditional Chinese veterinary medicine, that's going to be acupuncture, Chinese herbal medicine, Chinese food therapy, Tui Na, which is like Chinese medical massage, and also the fifth branch of Chinese medicine is Qigong or Tai Chi. We cannot teach our animals how to do prescribed movements with their breath. So we always say the substitute for that is daily exercise. But first we would do a Chinese medicine exam. I also incorporate a full Western exam as well because we do practice integrative medicine. And then I would decide where Holly has imbalances. So does she have too much of something or not enough of something? Or is there stagnation? So stagnation most commonly is going to be pain. Okay, and so that's basically, if you think about energy flowing throughout the body, if something is stagnant or stopped or blocked or obstructed, everything backs up behind that, and that can cause pain. Just like if you have abdominal fullness, right? You feel that bloat, and you're like, that is painful. Okay, so that's the same thing in our animals, but we take it beyond just the physiological bloating. We also take it to, is there a blockage of Chinese medicine blood or Chinese medicine qi? Okay, so with Holly, for example, I would do an exam and I would check her ear temperature. We would check primarily tongue, pulse, and temperature. Temperature, again, 3,000 years ago, no thermometer. So they found by checking the ear temperature, that was a way of checking an animal's temperature. We look at the color of the tongue. We look at the shape. We look at if they're tongue coat. So this all gives us information about what's going on inside the body. We also check the pulse. So in Western medicine, we'll check the pulse. Are they present? Is it synchronous with the heartbeat? Okay, and that's what we're looking from a Western perspective. In Chinese medicine, that pulse gives us information again into the body, because we have 3 pulse points on each side that gives us information about the Chinese internal medicine organs. Again, as we spoke about the kidney, Chinese internal medicine organs are not just equivalent to Western biomedical organs, so they have a lot more function. So that'll give us an idea of, is there a deficiency or an excess there? What is the pulse quality? What about the rate? So there's so many different parameters that we look at with pulse. It really is quite an eloquent and detailed modality, and especially a way of making a diagnosis. So commonly, most people think about acupuncture for arthritis or for pain in general. Acupuncture can be used pretty much for any problem, including behavioral. Skin, it can help with some skin issues as well. But typically, we do see a lot of orthopedic issues. At our clinic, we do see a lot of geriatric patients. We see a lot of cancer, which is one of my favorite things to treat. So if it's simply orthopedic, what we'll commonly do is do electroacupuncture. So that's inserting dry needles, and then we'll hook that up to an electroacupuncture machine, which is a battery-operated machine. And we can show you all that once we start working on Holly. So when I do electroacupuncture, I can mediate the release of specific neurotransmitters. So I can release the beta endorphins, which is like our feel-good runner's high. We can also release serotonin, enkephalin, dynorphin, so we can get some pain management in like right away. So that's the beauty of doing the electroacupuncture. We also can use aqua acupuncture, which is the injection of liquids in specific acupuncture points. And so you can use simply saline, sterile saline, or vitamin B12. There's a lot of different solutions that you can use. Amongst them, we also use bioregulatory medicines. So we will use things like Trameal and Zeal. So by using specific liquids in acupuncture points, I kind of get a little bit more bang for the buck, right? So for, again, an orthopedic issue, I'd be like, well, I think she's more than likely going to need electroacupuncture and probably some aqua acupuncture. I may even use a Western product called Adequin, which is a polysulfated glycosaminoglycan, which can also be beneficial for the joints as well. So it runs the full gamut. In fact, when we do vaccines, I'll put them in specific acupuncture points that we believe is actually going to have a stronger immune system response.
Interesting. Now, just in general, as an aside, do you, right now, do you see more dogs or cats? And are they coming in with different issues?
We are very fortunate. We see animals for a whole host of issues. A lot of my clients whose animals have passed on now bring their puppies, which I think is fantastic. So for example, Jill, after her first dog passed away that I had taken care of, she was looking for another dog. And so she would go to the animal shelter and send me pictures. I'd be like, no, not this one. And she'd be like, why? And I would tell her from a Chinese medicine perspective, there would be issues that I could see. So she had one picture of a dog that, very, very cute, but had a very long back and a little bit overweight, already saggy in the back. And I said, if you want it, go ahead and get it, but you're going to probably see me a lot because we're probably going to have some back issues. So, Jill has, brought Holly to me, and, we do little tune-ups just to kind of keep her on top. I've had people bring in puppies, and we start them out right. So we look at what their constitution is, and how can that change with time.
Oh, yeah, no, I didn't mean to interrupt you there. But to just sort of keep us on track, what would you say are sort of the most common conditions that you think that this type of treatment could complement? So in terms of people, they're already treating their dog at a typical veterinarian's office, and I'm just curious what you think is most commonly coming in and can be best managed with both. Okay,
so pretty much every condition can be managed with both, which is why we really espouse integrative. It's not an us against them proposal.
Yes.
And we do want to work with the Western vets as well. I can fully practice Western medicine. I was trained at Davis, but my personal choice is I want people to see the benefits of using other modalities. Commonly, we do see arthritic patients. We see a lot of geriatric patients. So it may be, generalized arthritis, hind end weakness. We'll see urinary incontinence, fecal incontinence. In some cases, we'll see animals with cognitive dysfunction, kind of like doggy Alzheimer's.
Yes.
We see a lot of cancer. Cancer we will treat in conjunction with their Western veterinarian, or exclusively if the client has chosen to not pursue surgery, chemotherapy, or radiation. It's a very personal decision, and in some cases, the cancers may not be responsive to our Western treatments. So for us, it's very fulfilling to be able to treat diseases such as that. We have a lot of endocrinopathies, such as Cushing's disease. And we see some diabetes, but
kidney failure,
kidney failure, liver failure.
So common with cats.
Exactly, exactly. And that's where, using a modality like Chinese medicine is really beautiful, because we come to a dead end with Western medicine a lot of times. There aren't a lot of things that we may be able to do to treat an animal, or an animal may be resistant to the treatment. So we have a whole host of other options to utilize, which for us is extremely fulfilling. But yes, exactly, you're right. With chronic problems, I think in most cases Chinese medicine is really oftentimes the forefront of treatment.
Yes. Oh, yes.
Trauma, no. Don't come to see us with
Exactly.
a hit by car. Well, we can help afterwards.
Yeah, because in recovery.
Exactly.
And I know that when I did research and worked with women with breast cancer, that oftentimes it was 2 years after they'd had their chemo and their radiation, and they were still having bad side effects from that, even though their cancer was in remission. And so it seemed like some of these other therapies. Well, why don't we go ahead and demonstrate what some of this treatment would look like, since we've got Holly here. And I'd also like to say that I have looked at your website, and your examination rooms are, they're very striking in that they look relaxing, they look comfortable to be in for both the patient and for the human, because I know that I probably, end up stressing out my animals more, because I know how much they hate being on the metal table and all of that. And so it really looks like it's a completely different environment.
And we do have animals that at first they're a little bit apprehensive, and over the course of time, they see that this, it's a positive place, they feel better. Our joke is that we have nose prints on the outside of the door, because the animals are so excited, they come running in. Some of them will jump on the table like this and just they wait, and they're ready, and they're happy.
That's
so it's typically a pretty nice experience for them.
And that's so important, especially when you're using a modality like acupuncture, because the animal needs to be relaxed and calm. And so we say that it's not just simply the insertion of needles in specific points, but also the energy of the practitioner. We have also noticed that if the client is stressed out and I'm not quite sure, and I'm really bad around needles, sometimes we have them leave, and typically the animal will do better. I have one client that initially she was just and the dog was very difficult. We sent her out, and the dog was fantastic. And so thereafter, we would treat without her. And then her second dog that I'm treating now, she's like, no, I think I can stay in the room. And she does, and her dog does beautifully. And so it's nice, because she's also come around and become comfortable with it as well. But you're exactly right. We did set up our rooms to be comfortable and relaxing. We want the animals to come in and feel like they're kind of getting a little spa treatment. So.
Yeah. Well, you go ahead and start, and I know that from my own observations, and since I had, like I said, I had probably for a year, I was fortunate to be able to go once a week to help with migraines. And so, but I know that, you would, once you had the needles in place, then you would sort of lay and relax for 20 minutes or so. So
exactly.
So that's part, and I think that's what so many people think, that since their dogs or cats are rarely still in a veterinary situation, that they can't imagine how this could happen. So.
It is kind of fascinating, especially with the cats. Cats tend to be a little bit more problematic, but we're very fortunate. We have some really wonderful cat patients. I had one cat, she would actually get a little peeved when I would turn the electro machine off. She would kind of turn around and give me this little dirty look, which I thought was really funny. Easy, baby. Girl. Down.
Jill, have you, are there any special needs that companion dogs have in the sense of, I would think that sometimes maybe because they're working dogs that they don't get as much time just to play or to relax? Do they get, like stress diseases or something? And could they benefit from this treatment specifically?
Sure.
Maybe more so sometimes than other dogs?
They do get their on and off time, so they are playing at times, but it is, it's a lot of work for them, and they worry about, the people they're taking care of. Mm-hmm. And so, we do have Holly down. Down. Come on. She thinks that Dr. Yamate has treats. Holly, down. Come on.
Well, you can see just even by the way she's moving that she has really, it's not like any of these needles are causing her any pain whatsoever.
No, and she, if you met her outside of the studio, she's an Australian Shepherd mix, and she does agility, and she's, a pretty active, energetic dog. Mm-hmm. Mm-hmm. And, she is just fine. She just got a couple of needles in her feet.
Mm-hmm. And those are typically very sensitive, and she's great for it.
Which really, you didn't, you didn't see her flinch or scream or anything. She's, she's good with it. Hi. Yeah, so the working dogs, it can be stressful. And there's the other thing that Dr. Yamate does is, the Chinese herbs are very powerful. Mm-hmm. And so, they can be treated and just have the herbs, kind of almost take the edge off a little bit and relieve the stress.
So, are they actually taking herbs in the office in conjunction with the treatment, or
we send them home?
Or you send them, mm-hmm. And then are those in a pill form, or are those in a powder, or how are they administered?
So we have them in powder, we have them in capsule, we have them in tablet. You can also get them in tincture form. The tincture form is a little bit more difficult for a lot of people because it can taste kind of not so happy. Mm-hmm. But most commonly, we will use powder or capsules and tablets. And then some people will mix them in directly with the food. Mm-hmm. Some people have to pill their animals. It just really depends. Mm-hmm. Cats, cats can be a little bit more difficult. Yes. We have some cats that will actually eat them out of their owner's hands. Very atypical. Mm-hmm. My own cat, he'll eat whatever I put in his food, so he's very easy to herb as well. Dogs usually are a little bit easier to get to accept the herbs, and there's a whole range of herbs and what they taste like. So we say oftentimes that when the body needs something, it tastes good to us, and so in general, I typically don't have a lot of problems, getting my patients to eat the herbs. It's when they have to have a lot of different ones for multiple problems that you start having to go like, maybe we need to, how can we streamline this approach and maybe just do a few herbs and do something else, instead of treating everything with the herbs. Mm-hmm.
Now, so in general, then these different placements that you have, are you treating her for anything in particular, or is this just sort of like a general sort of preventative, wellness type of
so for Holly
placement?
We wanted to pick some points that were going to be, pretty straightforward points, and also for demonstration purposes. Okay. Holly is kept in really good condition, and so we wanted to use her just because she's cute, right, and she's fun, but she also does not have a lot of issues. So these are points that we can use empirically because, again, she is an agility dog. I'd actually like to get a little more points on her back, but she's standing up, and I don't want to, get a little obtrusive there. But what we can show you is when we use the electroacupuncture box. So this, I can select the frequency and the amplitude of the stimulus, okay? So by changing the frequency, I can release specific neurotransmitters. Obviously, we're also going to stimulate muscles and nerves at the same time, but we're using this specifically from a Chinese medicine perspective, but also for me, I also use it from a medical perspective. What are her orthopedic issues, or where do I think she's going to have stress or future problems? And I can use it preventively as well. So currently, Holly does not have any musculoskeletal issues, but for a reasonable tune-up or maintenance plan, we could do something like this. I typically would do a lot more points. I shouldn't say a lot more, but I would do more points, and especially would not forget the hind end. But for demonstration purposes only, we're going to limit it to this.
So I can see, yes, that certain breeds like for example, I have 2 rescue dachshunds.
Oh, okay.
So, so far so good in terms of back issues.
Good for you.
But I certainly have dealt with them in the past. And I'm very concerned about that. And so to the extent, apart from exercise and trying to keep them in a decent weight condition, which is not easy with them, I'm guessing that maybe some of this can be preventative.
Absolutely.
As well.
And also herbs. You can also use herbs kind of as a constitutional type of a program. But you're absolutely correct. Chiropractic, or we actually have to call it either veterinary spinal manipulative therapy, also known as manual.
Musculoskeletal manipulation.
Yeah. So the California State Board requires us to say musculoskeletal manipulation.
Okay.
Both of those, that can also be helpful just to make sure that everything is aligned appropriately.
Now, how are you guys finding Davis to be in terms of being, are we particularly receptive to, to having another option for our pets? As I know that it seems to me that as a resident here, I'm very fortunate to have such a high density of practicing vets.
Correct.
I think that's higher than, like, I spent a lot of time down with my parents in Southern California, and I don't have as many options, which surprises me. I think that we're sort of coming, I guess, I can't believe it, but to the end of our program. But I guess I did want to say briefly, are you finding that people are receptive to this?
Most of our clients, we draw from all over. We have I think the furthest somebody drives at this point is 2 hours to come and see us. But yes, Davis has been wonderful. We love where we're located. We've been very fortunate. We're part of the Davis Medical Center. The university has also started their own integrative program as well, and that was something that I'd really pushed for when I was a student. So I'm very pleased. But yes, Davis has been great to us. We love seeing the local residents as well as people who come from all over.
Well, now I know that what you were saying about that there at UC Davis, there is a program that offers this. What would be a website that folks could go to get general information about this sort of holistic veterinary medicine?
So the main organization, the website would be the American Holistic Veterinary Medical Association website, and that's www.ahvma.org. At this point, the website is under construction, so please be patient, but that is going to be the premier source for information about alternative modalities and also how to find a practitioner in your area.
Excellent, excellent. Well, I want to thank you both, well, all 3 of you, for talking to us again. And I think this is a fascinating topic and something that, as I think all of us are aging, we also potentially have aging pets, and we're all living longer. And so it seems like this can be a way to really improve our quality of life. So with that, I will say thank you again for being our guests, and thank you, listeners, for tuning in to another episode of In the Studio. And to view more of them, you can go to dctv.davismedia.org. And thank you.
Thank you.